This is chapter 22, and it's on the respiratory system. So it's important to study the respiratory system because understanding anatomy and function of the respiratory system can help assist you in treating patients with respiratory disorders, say like asthma. So we have the two major functions of the respiratory system are to supply the body with oxygen that's necessary for cellular respiration and dispose of the waste CO2 that is a byproduct of cellular respiration or waste product of cellular respiration. And then we have the circulatory system and respiratory system are closely coupled. And then the respiratory system also plays functions in olfaction and speech. The respiration involves four processes. We have two from the respiratory system and two from the circulatory system. From the respiratory system, we have pulmonary ventilation, breathing, moving air into the lungs, moving air out of the lungs. Then we have external respiration, which is the exchange of oxygen and CO2 between the lungs and the blood. The circulatory system plays a role in transport of oxygen and CO2 in the blood. And then we also have internal respiration, which is the exchange of oxygen and CO2 between systemic blood vessels and tissues. So up here we have the pulmonary ventilation, so breathing in and out, inspiration, expiration. And then we have external respiration, and this is where oxygen and CO2 are diffusing between the lungs and the blood. Then with the respiratory system, the circulatory system, we have transport of the respiratory gases, oxygen and CO2. And then finally, we have internal respiration, which is going to involve oxygen diffusing from the blood to the tissue and CO2 diffusing from the tissue to the blood. So we have major upper respiratory organs, and they are the nose and nasal cavity, paranasal sinuses, and the pharynx. And then we have major lower respiratory organs. They are the larynx, the trachea, the bronchi and branches, as well as the lungs and alveoli. So to look at some of these, we have the nose here, the nasal cavity is in here, the pharynx, larynx, trachea, and then bronchi, and then lungs, and that's pretty much all we can see in this diagram. Upper respiratory system. So the nose is the only external portion of the respiratory system, and the nose has a number of functions. Now make sure that while you're learning these functions, you learn all the functions, because some questions may ask you to pick out a function, and some questions may ask you to pick out what is not a function. So we have provide an airway for respiration, moisten and warm entering air, filtering and cleaning inspired air, serving as a resonating chamber for speech, and then housing olfactory receptors. And olfactory receptors are going to be the receptors responsible for our ability to smell. And the nose is divided into two regions, the external nose and the nasal cavity. The external nose includes a number of areas, the root, bridge, dorsum nasi, and the apex, and the nares, the nostrils. It's not nasi, it's nasi, excuse me, dorsum nasi. Then we have the nasal cavity. This is found within and posterior to the external nose. And we have the nasal conchae. The functions of the conchae during inhalation are to filter heat and moisten air, and during exhalation, these same structures reclaim some of the heat and the moisture. The paranasal sinuses form a ring around the nasal cavities, and they function to lighten the skull, secrete mucus, and help warm and moisten air. So we have the nasal conchae here, here, and here. We have some sinuses. Here's a frontal sinus, sphenoidal sinus. The pharynx is a funnel-shaped muscular tube that runs from the base of the skull to the vertebra C6. It connects the nasal cavity and mouth to the larynx and esophagus. There's three regions, the nasopharynx, the oropharynx, and the laryngopharynx. And so we can see their positions. Nasopharynx up on the top, oropharynx, and then laryngopharynx. So the nasopharynx serves as an air passageway. It's posterior to the nasal cavity. Soft palate in the uvula close the nasopharynx during swallowing. The oropharynx is a passageway for food and air from the level of soft palate to the epiglottis. And the laryngopharynx is a passageway for food and air, and it extends to the larynx, where it continues with the esophagus. And then again, same thing, nasopharynx, oropharynx, laryngopharynx. Here are your first questions. That's all I have. Have a good day.